Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Lucas is a 32-year-old man who has experienced back pain for many years. After several investigations and blood tests, he has been told that he has something called mechanical back pain. This back pain often affects him on a daily basis. He works from home most days as an investment banker, and when he goes into the office, he finds that he has a better day than when he works from home. Lucas tries to exercise, but finds that lifting weights makes his pain worse, and walking for long periods of time can also make his symptoms worse as well. Over the past few months, Lucas has made a plan to try to improve his health and see what he can do about improving his back pain. Although he hasn't been reliant on painkillers, he has often found that almost on a weekly basis, he does need to take some painkillers to help him sleep or move a little easier. Lucas booked an appointment with a new physiotherapist who has made an assessment of him and agrees with the previous conclusions made by previous clinicians that said that he did not need any surgery or any injection therapy. The physiotherapist, in addition to giving him exercises and recommendations for his lifestyle, suggested that he should try something called acupuncture. Lucas does not like that idea. He doesn't think that ancient medicine is real. He thinks that people who practice such things are called quacks. The physiotherapist has given Lucas some evidence-based information about what this really is, but Lucas is still not buying it. However, Lucas has been thinking that if he has been living with back pain for so many years and has had so many investigations, should he not try this new recommendation from his new physiotherapist? So, before we talk to Lucas about what he should do in this situation, let's answer the question: what exactly is acupuncture? And is it quack medicine? Acupuncture is a method of medicine, healthcare delivery, that has been used in China for over 2,000 years. It has been used to relieve different health conditions, such as pain in Lucas's situation. Acupuncture involves insertion of fine needles into specific sites of the body to do treatment, but also in some situations to prevent sickness. Acupuncture, as we mentioned, involves inserting these needles into the skin at very specific points in the back, neck, head, and sometimes the face. And the goal of it is to relieve the symptoms of certain conditions. These conditions could be pain, headaches, migraines, menstrual cramps, sports injuries. In some situations as well, acupuncture has been reported to help in people who are having side effects from cancer treatments, people who are experiencing subfertility or infertility, certain symptoms associated with menopausal hot flashes or irritable bowel syndrome. Also, it has been seen to be used in women who are pregnant but cannot use what we call conventional medicine to alleviate their symptoms due to risk of side effects or concerns to the baby. Acupuncture generally follows this ancient Chinese practice that thinks about the flow of something called qi. Qi, or energy, in Chinese medicine practice can be manipulated to then produce better results. Acupuncture thus addresses specific trigger points in the body, and these needles try to release any knotting or tension within those trigger points, stimulating release and stimulating results. So how exactly does this pressure treatment work? These points are called acupoints, and at these acupoints, along different parts of the body, 1, there can be rebalancing. 2, there can be a release of nature's happy chemical called endorphins that are really our body's own painkiller. Endorphins can also be released during different kinds of activities, such as exercise, such as massage, such as dancing, sex, eating. So endorphins are really our body's own natural painkiller, natural mood booster. During acupuncture, the therapist would normally take a history, find out what the concerns are, and then insert these disposable needles, which are sterile and extremely thin, into these pressure points. The needles will then stay in for a period of time, which could be up to 5 minutes, in some situations, maybe 10 to 15 or 20 minutes. And then the needles are removed and disposed. After acupuncture, someone might feel relaxed, restful. And for some people, they might need to have a few episodes of acupuncture treatment before they start seeing the relief. But the question is it safe to insert needles into my body at different acupressure points? Basically, the needles that are used for acupuncture are sterile and they are non-toxic. They're often made of steel and they're quite solid and firm. And like I said, they are very thin, sometimes as thin as a strand of hair. So generally, acupuncture is seen to be a safe practice when done at the hands of someone who is trained and licensed. Now, the question that Lucas had was, is acupuncture a quack treatment or is acupuncture a valid treatment? Now, in many countries, there's no legal regulation of the treatment. And so it's really important to find out if the person that is treating you is regulated or they are a formally recognized acupuncture practitioner. However, what we do find, based on the evidence of acupuncture so far, is that in some situations, it has been seen to improve symptoms, specifically in people who have symptoms relating to pain. Acupuncture has been seen to cover and manage pain involving the muscles, the skeleton, bones, and joints. And so the evidence that continues to increase is that acupuncture, as part of a holistic care plan, such as that which Lucas's physiotherapist offered him, can actually be truly beneficial. In some health systems, acupuncture is offered within insurance packages or within the universal healthcare program, as we see in certain countries. So what should we say to Lucas in this situation? We would recommend that he have further conversations with his physiotherapist. Ask any questions that he may have as to the role of acupuncture for him in his current condition, anything else that he may want to do to adjust his lifestyle. Obviously, taking on board the exercises that were given to him by the physiotherapist. It is interesting to note as well that acupuncture can often become part and parcel of the lifestyle of many people who want to have a holistic integrative health outlook and approach. So there we have it. Acupuncture, as we can see, has increasing evidence of its use in managing long-term pain, certain kinds of headaches and migraines, and joint and muscle pain in certain situations and conditions as well. Really important always to find out who the practitioner is and ensure that they are well trained to deliver acupuncture care. So that's it for me from today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.